topic I chose throughout what we have gone over as a class would have been this section, um, Hallucinations and Delusions, within Module 3, Sensations and Perception. Though we had not covered this section a lot in class, uh, but I was just intrigued with the symptoms and the causes of just both. Just going over this in class, I had learned that there are different types of delusions and hallucinations. In delusions, there are 9 different types. Uh, in hallucinations, there are 4 different types. With hallucinations, there's auditory, which is hearing voices, visual hallucinations, which is seeing things or people that are not there, olfactory, which is you smell or taste something that is not there, and tactile, which is you feel something that is not actually there. Like you feel bugs crawling on you, but there are no bugs at all. Or you feel somebody touch you, and in fact there's nobody there around you at that moment. In class we talked about the main differences between the two and really what the symptoms are. The differences between hallucinations and delusions is a hallucination is a false perception and a delusion is a false belief. I did some digging around and found one experiment over hallucinations. It is called the Gainesfield procedure. The Gainesfield procedure exposes the participant to an unstructured sensation by placing half ping pong balls over the subject's eyes so that they can only see diffused white light, and by playing white noise through headphones. The experiment is used to induce hallucinations and sensory distortions, which are more than likely to occur in the absence of clearly defined sensory experiences. Many of the people who had participated in the experiment thought nothing of it, but within a matter of time, each individual had experienced a unique and totally different hallucination. The common factor within the experiment was that everybody had gone absent-minded, basically blank, after having the ping pong balls over their eyes and hearing the white noise playing. For instance, one participant had experienced seeing a clearing in a forest and began to vividly describe what they were seeing as if they were actually there. The main purpose behind conducting the experiment is to test individuals for extrasensorial perception. This experiment can also be conducted at home or in the classroom, and it's perfectly safe to do. But unlike hallucinations, there are no experiments that I could find that have been done in that field of study for delusions. But delusions can be caused by multiple different things. They can be caused by genetic disorder, like for instance your family member can have the disorder, and there's a chance that that trait can be passed down to you. There's also a biological factor in obtaining the disorder, like if there is an imbalance in certain chemicals in the brain called neurotransmitters. These neurotransmitters have been linked to the formation of delusional symptoms. So an offset of that would be crucial. Lastly, there's the environmental, psychological aspect that can cause the disorder. Scientific evidence suggests that the disorder can be triggered by stress, alcohol, and drug abuse. It can also contribute to the condition. People who are also isolated are more vulnerable to obtaining the delusional disorder. However, how doctors find out and diagnose the disorder is they would do various types of tests and look up your medical history and physical examination. Although there are no laboratory tests to specifically diagnose delusional disorders, the doctor might use various diagnostic tests such as x-rays and blood tests in order to rule out physical illness as the causes of your symptoms. If the doctor does not find any physical disorder, they might refer the person to a psychiatric or a psychologist. The psychologist then would narrow down the types of disease or disorder through an assessment of questions and activities. With hallucinations, they can be caused by many of the same things as delusions, such as illnesses like schizophrenia and dementia. Uh, Illegal drug abuse and or alcohol abuse can be a main cause. Certain combination of medications that have been prescribed to take can cause hallucinations. A loss of vision, such as macular degeneration or Charles Bonnet syndrome, increases vulnerability of having hallucinations and starting to hear things. Hearing voices is a recognized symptom of schizophrenia or dementia or bipolar disease, but they can very well not be related to the mental illness at all. Mostly, all that has been done to cease the hallucinations that a person is experiencing is through medication, and hopefully try and even offset the chemicals in your brain. The process is a lot of trial and error because it's hard to narrow down a type of medication that would work with a certain individual and what medication doesn't work. Medication is the form of treatment for both hallucinations and delusions, depending on what kind of disorder you have. You might have to take medication for the rest of your life. Say, if you have a disease like schizophrenia or dementia, you'll have to take medication to even out the chemicals in your brain for the rest of your life. Like my grandfather suffers with dementia, and it keeps getting worse. And the only way we can offset most of the chemicals in his brain is to give him medication, have him take pills every morning and every night. For an example of dementia, having first-hand contact with my grandfather. One of the examples of dementia is believing that somebody loves you, and that's exactly the case with my grandfather. He's been, I want to say, chasing women, trying to marry them because he believes that they want to marry him, but in actuality, they want to have nothing to do with him. And we've had to delete cell phone numbers, delete contact information, in order to keep him safe and keep other people safe. That's just what we kind of have to deal with, and those are one of the side effects of dementia. Statistics show that about 1 in 20 people in the general population have experienced at least one hallucination or some sort of delusion in their lifetime that was not connected to drugs or alcohol or dreaming, according to a new study. There are also different kinds of effects hallucinations can have on your brain besides experiencing something that is not there, such as delirium, which is a state of mind that is caused by a fever, seizures, migraines, dementia, Enton syndrome, which is a brain damage occurring in the optical lobe, or Charles Bonnet syndrome. Some long-term effects that can happen later on in life throughout obtaining the disorder would be Parkinson's disease or schizophrenia. All the effects that occur during the stage in their life all lead up to a shorter life expectancy due to either the illness or self-inflicted harm due to the mental instability. Sometimes with schizophrenia is more than likely going to end their terms in their own hands, and due to depression that takes effect after having internal conflict, family problems, not being able to go to work or school, social isolation, being the victim of aggressive behaviors by others, and substance abuse such as drugs and alcohol. On the other hand, somebody that suffers Parkinson's disease, normally over the age of 60, are more prone to fatal falls due to not having control to their legs anymore, or just control of their body anymore. accidentally breathing in foreign objects, like breathing in food on accident, deep clots that can block the arterial blockage into the lungs. With, with these factors, one's life expectancy has gone down compared to the general population, but proper care and therapy, an individual's life expectancy can go back up to the general age of 87 for men and 90 for women in the United States. Thank you.